Welcome back to the deep dive. We often look at the immediate effects of major global events,
Hmm.
but it's fascinating to consider the ripple effects, like how the pandemic might have shifted things in ways we're just starting to understand.
Absolutely, yeah. The long tail of these things, right?
Exactly. So today, we're going deep on a study from the School of Nursing and Midwifery at Trinity College, Dublin. They're looking at drinking habits in Ethiopia, specifically heavy episodic drinking, or HED, among folks already managing non-communicable diseases like heart disease or diabetes.
That's a crucial area to examine for sure.
Oh, absolutely. And get this, one of the things this study suggests is that the pandemic might have actually increased instances of HED in some parts of the world.
I mean, it makes you wonder, right? Like, was it stress, isolation, disruptions to routine? So many factors could be at play.
Right. And healthcare disruption seemed to be a big part of the picture, too. But before we get ahead of ourselves, let's define HED. What exactly are we talking about when we say heavy episodic drinking?
So HED is when you have at least 60 grams of pure alcohol on at least one occasion within a 30-day period. To put that into perspective, that's about 6 standard drinks.
6 standard drinks, wow.
Yeah.
So 2 bottles of wine, let's say, in a single sitting?
That's about right.
Okay, so even just one night of, really heavy drinking a month is considered HED.
Yep, that's how it's defined.
And this has got to be a big concern, especially for people already managing conditions like heart disease or diabetes, right?
Absolutely. Think of it this way. If you have a heart condition and your doctors told you to cut back on salt, heavy drinking is like dumping an entire salt shaker on your dinner.
Ooh, I like that analogy. Makes it really clear. Okay, so let's dive into this study from Trinity College, Dublin. Can you give us a quick overview?
Sure. So it's a cross-sectional study done at Arba Minch General Hospital in Ethiopia. They looked at 310 patients with non-communicable diseases.
Okay.
And they used this tool from the World Health Organization called the STEP-PS tool to gather data.
All right, and when was this data collected?
Between March and April of 2022.
So right in the thick of things, pandemic-wise.
Yeah, definitely. People's lives were still being significantly impacted.
Okay, so what jumped out at you from the findings?
Honestly, one of the first things that struck me was how few participants were actually sticking to those recommended lifestyle changes for managing their conditions.
Like diet, exercise, the whole 9 yards.
Exactly. Healthy eating, regular exercise, quitting smoking, and of course, cutting back on alcohol. Only a tiny percentage, like 7.7%, were following all of those recommendations.
7.7%, that's shockingly low. I mean, why do you think adherence was so low?
Well, I think we have to remember the context here. These folks were living through a global pandemic. Routines were disrupted. Lockdowns limited exercise options. Access to healthy food might have been difficult. And stress levels were probably through the roof.
It's true. It makes you wonder,
Yeah.
how much can we realistically expect from people in those circumstances?
Right.
But even with all that considered, 7.7% is really striking. What about HED specifically? How prevalent was it among these patients?
So they found that 12.6% of the NCD patients in the study engaged in HED.
Okay, so even though very few are following all the recommendations, there's still a sizable portion engaging in HED.
Right.
Did the study say anything about why that might be?
Here's where things get really interesting. Nearly half of the participants, 45.8%, reported an increase in alcohol consumption during the pandemic.
An increase? Wow, that's a pretty big jump.
Hmm.
I mean, it makes you think, did you know anyone, or were you yourself maybe turning to alcohol more often during the pandemic?
Yeah, I think a lot of people can relate to that.
It was a stressful time for everyone, for sure.
Yeah, absolutely. And the pandemic had a huge impact on mental health globally. Increased anxiety, stress, isolation.
Yeah.
It's understandable that some people used alcohol to cope.
So a possible link between the pandemic, increased anxiety, and then HED. Did the study explore that connection any further?
They did, and it's one of the key findings, actually. The study found that folks with higher anxiety levels, which they measured using something called the coronavirus anxiety scale,
Okay.
and those who had experienced healthcare disruptions were more likely to engage in HED.
I mean, it's not surprising when you think about it. People were missing appointments, worried about their health, facing so much uncertainty. It makes sense that some might seek comfort in alcohol, even if it's not the healthiest coping mechanism.
Right, exactly.
It's important to understand the why behind these behaviors to really grasp the complexity of the situation.
I agree, yeah. Acknowledging those feelings and understanding why someone might seek comfort in alcohol is crucial.
It reminds us that we're dealing with real people navigating really challenging circumstances.
Absolutely.
Now, I'm curious, aside from the pandemic and anxiety, were there any other factors the study linked to HED in this group?
Yes, actually. The study also found that tobacco use and cot use were associated with HED.
Tot use. I'm not familiar with that.
Oh, cot is a stimulant common in East Africa.
Interesting. So you have these multiple risk factors potentially feeding into each other.
Exactly. It's not just about one thing in isolation. It's this complex interplay of factors that contribute to someone's vulnerability.
That's a really important point to remember as we delve deeper into this topic. But for now, we're going to take a quick break. We'll be back in a moment to continue our deep dive.
Sounds good.
Okay, so we've been talking about how the pandemic may have actually increased HED,
Right.
especially among people with non-communicable diseases. But this study focuses on Ethiopia. What about the rest of the world? Did the pandemic impact drinking habits everywhere in the same way?
Well, not necessarily. There's this report, the World Health Organization's Global Status Report on Alcohol and Health and Treatment of Substance Use Disorders from 2024.
Okay.
And it highlights some interesting regional differences. Some countries actually saw a decrease in alcohol consumption during the pandemic.
A decrease, really?
Yeah, kind of surprising, right?
Yeah, that is surprising. What would cause a decrease, you think?
Well, in some places it was government policies, like restrictions on alcohol sales or closures of bars and restaurants.
Makes sense.
And in other cases, it could have just been shift in social behaviors. People weren't going out as much, socializing as much, so fewer opportunities to drink.
Yeah, less opportunity, less drinking. Makes sense. But this study we're looking at, they found an increase in HED in Ethiopia. So why the difference?
I think that's where understanding the local context is really important. The cultural and social factors that are at play.
Right, because even if there's a global pandemic, it's not going to affect every community in the exact same way.
Exactly. And, this study found that 43.3% of current drinkers in Ethiopia engaged in HED.
Okay.
And that's higher than the global average.
So HED was already more common in Ethiopia even before the pandemic.
That's what the data suggests, yeah.
So what's driving that? What makes Ethiopia different?
Well, if we look at the broader picture, it seems like cultural norms and attitudes toward alcohol play a big role.
Okay.
And this study specifically mentions religion as a factor.
Okay. Interesting. How so?
For example, none of the Muslim participants in the study reported engaging in HED, most likely because of religious prohibitions against alcohol consumption.
Makes sense.
But a majority of the Orthodox Christian participants did report HED.
So within the same country, you see these variations in drinking habits shaped by different religious beliefs.
Exactly. And that's just one example, right?
It really underscores how complex this issue is.
It does. And it's a good reminder that we can't just look at statistics in a vacuum. We have to consider the cultural and social influences, too.
Absolutely. Now, I'm also thinking about the fact that this study was conducted in a hospital, focusing on patients with non-communicable diseases.
Right. So we're not dealing with a representative sample of the entire population.
Exactly. So there could be other more specific factors contributing to these higher rates of HED within this particular group.
Absolutely. Things like poverty, limited access to healthcare, and just the overall stress of living with a chronic illness could all be playing a role.
It makes you think back to that connection we were talking about earlier between anxiety and HED.
Yeah, exactly. It makes sense that people facing these kinds of additional challenges might more likely to turn to alcohol as a way to cope.
Right, it's that search for comfort in the face of adversity.
Exactly.
But even though it's understandable, it's important to remember that relying on alcohol isn't a sustainable solution.
Absolutely. And in fact, it can often exacerbate the problems people are already dealing with.
Right, it's that vicious cycle where you feel stressed, you drink to cope, but the drinking ends up adding to your stress in the long run.
Exactly. It's a slippery slope.
So out of all of this, what do you think is the most crucial takeaway for our listeners?
I think the key takeaway is the need for interventions that really address both the physical and mental health needs of individuals with NCDs.
Okay, so it's about taking a holistic approach, right? Recognizing that people are complex, their lives are complex.
Exactly.
And we can't just focus on treating the disease in isolation.
Right. We have to think about the social and psychological factors that are impacting their health, too.
Because those factors are just as important as any medical intervention.
Absolutely. It's about providing support that goes beyond just medical care.
Right. So what might that look like in practice?
Well, it could involve things like connecting people with mental health resources, helping them navigate financial stressors, or even just supporting community-based programs that foster social connection and support.
It's about creating a safety net to catch people before they fall through the cracks.
Exactly.
But the million-dollar question is, wow, how do we actually implement these kinds of interventions? What can be done to address this issue effectively, especially in a setting like the one in this study, where resources might be limited?
That's a great question and a really important one. I think we should explore some potential solutions when we come back for the final part of our deep dive.
So we've been exploring this idea of heavy episodic drinking being potentially linked to the pandemic
Yeah.
and all the stress and disruption that came with it.
Right, and particularly among people already managing these non-communicable diseases.
Exactly. But now the big question is, what do we do about it?
Yeah, that's the crucial part, isn't it?
Are there actually effective strategies or interventions for tackling this?
Well, the good news is the authors of this study offer some pretty practical suggestions.
Oh, good.
They really stress the need for targeted interventions, especially for those NCD patients who experienced healthcare disruptions during the pandemic.
That makes sense. If people are already struggling to get basic care, something like HED is going to be even harder to address.
Exactly.
So what do they suggest? What kind of interventions?
One key strategy is making screening for substance use a routine part of NCD care.
Okay, so like during a regular checkup for diabetes or heart disease, the doctor would also ask about drinking habits.
Yeah, exactly. That way they can identify folks who might be at risk for HED and intervene early.
Catch it before it becomes a bigger problem.
Exactly. An ounce of prevention is worth a pound of cure, right?
Right. And what would these interventions look like?
They could take many forms. It might be brief counseling sessions, referrals to specialized treatment programs, or even just providing information about the risks of HED and some strategies for cutting back.
So it's not about forcing people to abstain from alcohol completely.
Not necessarily, no. It's more about giving people the knowledge and support to make healthier choices.
Empowerment rather than judgment.
Right.
Okay, so screening and early intervention. What else?
Another big recommendation is strengthening those connections between hospital-based healthcare systems and programs in the community.
So kind of bridging that gap between the clinical setting and people's everyday lives.
Exactly. And that's how we can start addressing some of the broader social and economic factors that contribute to HED.
Because those factors are huge, right?
Yeah.
It's not just about individual choices, it's about the environment people are living in.
Absolutely. Community-based organizations can be really valuable here.
How so?
Well, they often have a much better understanding of the specific challenges people are facing in their own neighborhoods.
Right, they're on the ground working with people directly.
Exactly. And they can offer all kinds of support services, job training, financial assistance, or even just a safe space for people to connect with others.
Building that sense of community and belonging.
Exactly. And those things can go a long way in reducing stress, building resilience, and ultimately making it less likely that people will turn to alcohol to cope.
It's about creating a support system that goes beyond just the doctor's office.
Right.
Now, I'm also remembering that link we talked about between anxiety and HED. How do we address the mental health piece of this puzzle?
That's where integrating mental health support into NCD care becomes really critical.
Okay, so what would that involve?
Well, ideally, mental health services would be readily available alongside treatment for physical health conditions.
It just makes sense, doesn't it?
It does, and it can help reduce the stigma around seeking help for mental health issues.
Right, because your mental health is just as important as your physical health.
Absolutely.
This has been such a fascinating conversation. It's amazing how much insight we can gain from diving deep into a single research study.
It is, isn't it?
And it makes you realize how much more there is to learn.
Oh, absolutely. There's so much research out there,
Yeah.
so many different perspectives and angles to explore.
And that's what we're all about here on the Deep Dive, exploring these complex issues, sharing what we learn, and hopefully encouraging our listeners to do the same.
Exactly. Keep learning, keep asking questions.
So as we wrap up this deep dive on heavy episodic drinking, what's one final thought-provoking question you want to leave our listeners with?
Think about your own community. How has the pandemic affected drinking habits where you live? Are there any local organizations working to address this? What can you do to help create a healthier and more supportive environment?
It's a call to action for all of us, really. We've all been touched by the pandemic in some way, and this issue of HED is just one example of the many ways it's impacted our lives. Thanks for joining us on the Deep Dive, everyone. Until next time, keep exploring, keep learning, and keep asking those tough questions.